Adverse health effect of low-level pesticide exposure. And unfortunately, this concept may be a lot more relevant than we're used to thinking about. This general topic is the effects of low-level pesticide exposure. I have no financial conflicts. And my advent into this whole area started in a room that looked something like this, but it was 4 times bigger. It had several hundred people in it, all from Kauai, or mostly from Kauai, or mostly from Hawaii, probably. Many of them had blue shirts, many of them had red shirts, and it was about a mini civil war that was going on Kauai about the issue of heavy pesticide spraying on the west side of the island. It was reported that 18 tons of pesticides was being sprayed in a relatively small area. And the reason I got involved was this American Academy of Pediatrics policy statement that was published in November of 2012. So this was published months before the Civil War broke out. And I'm going to go into it, but basically it said that pediatricians needed to be concerned about low-level pesticide exposure. So the pediatricians on the island, we read this and we thought, we should say something about this little civil war going on. We should submit testimony that there is a concern about low-level pesticide exposure. And that led to me speaking to that group there. And it was kind of a daunting experience because these were angry people on both sides of the issue. Activists were wearing the red shirts and people coming from the farms. Many of them bussed in, even from other islands, were wearing the blue shirts. The opening lines in this AAP policy statement was that pesticides are products designed to kill or harm living organisms, making them inherently toxic. The influence of low-level exposure on child health are of increasing concern. And this was kind of a paradigm changer for pediatricians like me. I had been trained to think about acute poisoning, but recognizing the health impacts of chronic low-level exposure was a change. It wasn't anything that I'd ever even really thought about. And what they said in this paper, the paper was kind of daunting in what it presented, is that there are increasingly established associations between chronic low-level pesticide exposure and a variety of issues. Two of them in there is cancer, and two of the cancers they talked about the most was leukemia and brain tumors. Essentially, they said that leukemia is associated with household pesticide use. So just think about this. This is spraying around your house, the quarterly spraying you might get done, or bug bombs. And the brain tumors are linked to both residential and agricultural pesticide exposures. And that was an issue because of what we were talking about on Kauai is heavy agricultural spraying on the west side of the island, and people were being exposed. Cancer risk appeared to be dose responsive, which is obvious probably, but there is heightened vulnerability periods. That was during pregnancy and early childhood. In addition, they said pesticide exposure is associated with endocrine system disruption, again, chronic low-level pesticide exposure. And the areas that they pointed out for that was estrogen mimicking effects, decreased testosterone, disruption of the pubertal process, and possible cryptorchidism. Pregnancy complications was on their list. Preterm birth defects, impaired fetal growth, meaning small for gestational age, all were effects that have been associated, and this thing was heavily referenced. They were carefully going through study after study that was showing these issues. And then neurobehavioral issues, and I'm going to bring this up later as an issue. But basically, they were saying there was growing evidence that shows that chronic low-level pesticide exposure impacts neurologic development and function. And the issues they were talking about was developmental delay, behavioral disorders such as ADHD, autism spectrum, motor skill impairment, and that these could be long-term consequences, that these effects may persist into adulthood. Some of these studies came from very well done studies out of Berkeley and New York City that showed a particular insecticide, chlorpyrifos, directly and significantly creates developmental delay in children. They talked about children being particularly vulnerable in several ways. One is a developing fetus. If you can kind of imagine A developing fetus goes from a few cells to this amazingly complex neural network. And if you take something such as one of these insecticides that are designed to interrupt the neural pathway of insects, and the pregnant mother is exposed to even low levels of this, it can change that neural network development in the baby and affect that baby for the rest of their life. Small children, they talk about hand to mouth. The children are on the floor, putting their hands in their mouth. The amount they eat is greater compared to their body, their body size, so that the exposure by small amounts in the food can be more critical, and that there is placental transfer of these formulations. So again, more dangerous to the fetus. So the AAP came out with this document, and they made recommendations, which is what got me into trouble because I tried to follow the recommendations. They said that we should discuss the potential dangers of excessive pesticide use in the house and yard with our parents, basically. We should talk about decreasing the use of bug bombs and household spraying by doing several things. By one, trying to be better about removing food waste so we don't attract bugs. And two, using traps for bugs and insects much more than we use spraying. And they also suggested common sense kind of things, that we don't have our children go out in yards that have been freshly sprayed with different pesticides, and the same thing for parks that have been recently sprayed. And they talked about pediatricians being a little more active on a community and a legislative basis, that we should advocate for comprehensive integrated pest management around schools. That means using pesticides that aren't necessarily the most toxic. You can even use things like vinegar and salt and so on around schools, child care facilities, and other community settings. They talk specifically about designating no spray zones for what they call restricted use pesticides. These are pesticides that are particularly toxic, and they suggest that there be no spray zones around schools and places that children congregate. I'm going to come back to this in a minute, but they also suggested that we work with communities to support transparency laws. And what they were talking about is we should know what's being sprayed where. These companies should be required to do geospatial documentation of what they're spraying where, and that families near areas that are being sprayed should be notified when spraying has happened. And the reason for this, particularly the geospatial part of it, is California leads the nation in knowing what kind of conditions, such as autism, are associated with being close to agricultural fields. We can't know this in Hawaii because we know in general what's being sprayed in a large area, but we have no idea specifically what's been sprayed in closer areas. And that's an issue I'm going to come back to because it had to do with a study that we did here on Kauai. I'm going to just summarize because I actually would like to leave people with this message, particularly the pediatricians in the audience. So they're saying chronic low-level exposure, the kind you can get from living near an agricultural field or from spraying in your own house, has an increased cancer risk, particularly leukemia and brain tumors, increased endocrine disruption risk, particularly critical hormone systems, neurobehavioral, ADHD, autism, developmental delay, increased vulnerability just by being children or fetuses, and that pediatricians should be active. We certainly should be talking to our parents, and that we might consider being active in legislative issues. On the legislative issues, the reason I was asked to do this talk is the Hawaii chapter of the American Academy of Pediatrics supported two pesticide bills this year. One was to increase no spray zones around schools, and the other was more improvement in right to know. As has happened in the last 3 years, all bills died in session, so none of them were passed. And a school, you can spray restricted use pesticides 100 feet from any school. It's less of an effect on Kauai because we actually made it an issue through our teachers union, but it is an issue elsewhere in the state. So a question that comes up, and which is I just kind of got into, was should we be concerned about pesticide usage in Hawaii? This is a recent weekend here on Kauai. So what happened is because I was the speaker in that room that was fraught with tension, I was asked to join a state-sponsored task force called the JFF. And we were asked to look at the two West Side communities and decide, not do new studies, just look at studies that had been done and try to make some type of decision if there was evidence of harm to the people or the environment from the heavy spraying down there. We met for 15 months. We wrote a 100-page paper, but basically we said, there are conditions here in this island that may be associated with excess spraying and conditions that are associated with chronic exposure to pesticides. And they were issues like obesity, diabetes, increased all-cause mortality from cancer, increased dialysis usage. But we had to be very clear that we had no specific evidence that they were connected to the spraying. There was no biologic studies, meaning nobody had looked at urine or blood of people to see if there are increased levels of pesticides. And there were very few studies demonstrating pesticide drift. So we could say, yes, we have a community that's unhealthy in several ways that may be related to pesticides, but we can't tell you if pesticides did this. But we did find some evidence that made kind of a ripple. We had 2 years of information from the school system. And what we found is if we isolated the two West Side elementary schools that their parents or the families came from catchment areas where the spraying was, these are these slides on my left, and they are, it says Waimea underneath it. We saw a pretty dramatic difference in developmental delay in the elementary schools compared to the rest of the island. We also looked at other disabilities. That was their title. It was mostly ADHD, and we also saw a pretty dramatic difference. And we looked at Easter seals work. It wasn't as dramatic, but we did see a difference too. In addition, what we found in our research is that chlorpyrifos, which I mentioned earlier, was being used at 3 times the rate usually used in the mainland. And chlorpyrifos, particularly through these excellent long-term studies that were done at one at Berkeley and one at Columbia, is strongly associated with developmental delay. What they found is using biologic markers, cord blood levels and urine levels in the mothers and the cord blood at birth, the level in those biologic levels were directly correlated with decreases in or increases in developmental delay in the children. So the higher the level, the increased developmental delay and the increase in adverse MRI changes that these children demonstrated. I'm not sure of all the reasons that went into this, but the word got out about that part of what we did, and there were other concerns just about the amount of spraying that was being done anyway. And in 2018, Hawaii became the first state in the US to ban chlorpyrifos for agricultural use. And following our example, the rest of the US and the European Union followed. There's an effort for it to come back, just like there's an effort for a lot of EPA issues to be decreased. But at this point, we could take credit and feel proud of the fact that we made a difference on that level. Okay, so that was paper number 1. That one paper was, as I said, published in 2012. In 2024, the AAP published another paper. This paper was about Roundup in GMO foods. Paper came out, and immediately there were headlines around the country and around the world criticizing the AAP. These were headlines that I just picked up from the news from just looking for them. Here's one: a good journal breaks bad. AAP spreads information about glyphosate. This one is pretty dramatic with this big X across the American Academy of Pediatrics saying the AAP is having misinformation. Another headline was, did the largest pediatrician group miss the mark on GMOs? The title of this paper, which seems pretty innocuous, is The Use of Genetically Modified Organisms, GMO-Containing Food Products in Children. And the lead author was a Stephen Abrams, who I've talked to since, and he said that attacks continued long after the paper came out. I'm going to leave you with a visual before I jump into that paper. So this was a Hawaiian celebration of the equinox 2023. This is Palaki Flores, a Hawaiian cultural practitioner. And what he was saying right there is that there is this confluence of interconnectedness of life forms from the top of a mountain to the bottom of the sea that makes for healthy ecosystems. And this is what the Hawaiians deeply believed, and they celebrate this in these equinox ceremonies. The next two slides are a little different. So this is a field that's been recently sprayed with an herbicide, and this herbicide created a layer of death. And if this herbicide is glyphosate, it also creates a layer of death in the first centimeters of dirt. This is a field that is being sprayed with, these are GMO crops that are being sprayed or most likely sprayed with glyphosate. And what glyphosate does to a GMO crop, it doesn't kill the crop, but it kills all the weeds in between the crop. Because what happened is the GMO crop was bred to be resistant to glyphosate, which is a powerful herbicide. So rows of death between the crops. Crops are healthy, and the crops arrive at our dinner table with glyphosate. So this paper makes the point that the primary concern of the AAP is not with the science of genetically engineering food. Their concern is that genetic engineering in the US has been mainly used to allow the crops to be sprayed repeatedly with Roundup-like herbicides and not die. So they weren't taking on the science of genetic engineering. They were taking on the fact that the main use of genetic engineering in the US was to make crops Roundup resistant. And the result is that the chemical glyphosate has been added to our diet and our bodies. Of interest, the papaya in Hawaii is a GMO success story. It was being killed by a virus, and they did genetically engineer that papaya. It's not sprayed with glyphosate. It's just that it now doesn't suffer from the effects of the virus. So they talk quite a bit about this GMO issue. The point that they made pretty strongly is that essentially, again, the idea GMO crops in America mostly are used to allow it to be sprayed with glyphosate, Roundup-like herbicides. And we should understand industry drivers. This genetic trait was developed by Monsanto, and it's used by other chemical corporations, and these are corporations that produce herbicides. So, you know, it was a very intelligent move for a company that wanted to sell more herbicides. And that there's market dominance. 90% of the US soy and corn are GMO products in the US. So if you get non-organic soy, non-organic corn, non-organic canola oil in the US, it has glyphosate in it. And they wanted to know where this GMO presence is. It's in our processed foods. So almost all processed foods have corn products, soy products, canola oil, so they almost all contain glyphosate. Animal feed, animals are frequently fed either genetically engineered grains, such as alfalfa, or they are given other grains that are sprayed with GMO, with glyphosate, which I'm going to get to later. But animal feed frequently has glyphosate in it. And they went on to say that infant formula, if it's non-organic, often contains or usually contains some type of corn syrup derivative or soy, and these are definitely from GMO sources, or most definitely. 90% of these products are from GMO sources. They talked a little bit about this herbicide, that 0.4 million kilograms of glyphosate were used in 1974 when it was patented. In 2014, there was a 250-fold increase in the use of this herbicide. And it's the world's most widely used. It's actually the most heavily sprayed herbicide in the history of the world. So the issue is, what's the problem? They mentioned three. One, that the residuals stay in our food. Two, that the human exposure across the US is enormous. Most studies show that 80%, studies where they're looking for who has glyphosate in their urine, 80% of US samples are usually positive. And again, they pointed out that their main issue with the GMO food is not the GMO science, but the fact that it's used as a methodology of getting herbicide into our diet. And then the issue is, what's the problem? And again, they listed several things. Cancer risk is one. 2015, the WHO classified glyphosate as a probable carcinogenic. A meta-analysis was done later, and they showed a 41% increase in non-Hodgkin's lymphoma risk in people that heavily were exposed to glyphosate. These are people that spray it or mix it. And another pharma study showed that farmers who used glyphosate had a 36% increase in diffuse large B-cell lymphomas. Again, there are issues with reproduction and development, again, association with preterm birth, potential sex-specific endocrine disruption, and animal studies consistently showed similar effects. The AAP was very measured in their clinical report. Their points were well referenced and carefully stated. The greater scientific community, though, has a lot more to say about the possible risk of glyphosate. So I want to be clear. So the whole first part of this, and these blue-colored slides, has been data from the AAP studies and papers on the product. As I move forward, these are from a variety of other sources, and I list them at the end. But essentially, in the late 1980s and through the 1990s, our food became very different from any other time in human history. And the reason is that we added glyphosate to our food. Prior to that time, glyphosate was just used around fields because it's an herbicide and it kills crops. But in the mid-90s, Roundup-resistant food became increasingly prevalent in our diet, and the crops that they corrected in this fashion, that they created this Roundup-ready resistant gene, were soy, corn, canola, and sugar beets, and also alfalfa. And the majority of them, if they're non-organic, are Roundup-resistant crops. But in addition, in the late 1980s and then through the 1990s, Monsanto taught farmers you can desiccate your crops and make them much easier to harvest. And what that basically meant is that you could spray the crop right prior to harvest. It would kill the crop and dry it out, making it easy to harvest. You could schedule the harvesting, and a very large number of crops have ended up this way. So much of our wheat is desiccated before it's harvested. Oats are desiccated. I'm going to give you a list later on, but it's surprising how many substances are non-GMO, but they're sprayed with glyphosate prior to harvest. So in March 23, Berkeley came out with a very important study, which I don't think got enough publicity. They were the ones that had done the study on chlorpyrifos. They had 20 years of biologic substances and history on children that they followed from birth and shortly after birth till age 20. And what they were asked to do is to go back and look at these children at age 5, look at their urines, and see how much glyphosate was in the urine, and then look at these same children when they were age 18 and see what it showed. And essentially what they saw is the higher the level of glyphosate in the urine of a 5-year-old, the greater evidence there was of metabolic disorders in these children at age 18 when they checked them again. And the metabolic disorders they saw were the type that they saw inflammation in liver and metabolic disorders. So the types that can lead to liver inflammation, liver cancer, diabetes, obesity, cardiovascular disease later on in life. But there's signs of it were already there when they were 18, increased hypertension, increased obesity, and increased biologic changes that are compatible with metabolic disorders. In addition, the evidence is all around us that we've become very unhealthy as a nation in the 30 years since glyphosate was added to our food. And I'm gonna show some graphs, but before I start these graphs, what these graphs show a correlation in time. We know as physicians and scientists, or anybody interested in science, a correlation in time is not proof of causation. It's just a correlation in time. But they were such striking correlations that people that are interested in this topic have been making more of them. So this first graph is just showing the increase in glyphosate spraying on different crops. And that same curve is going to be in every one of these graphs. And you can see it starts at 1991 and it finishes at 2010. So you can see this sharp escalation in the amount of glyphosate that was put onto our crops. They then looked at a large number of medical conditions, and 22 of them had similar graphs to this. So the little bars, the vertical bars, are the incidence year over year of, in this case, it's prevalence of different medical conditions. So this one is diabetes. And what is striking is that the increase in this prevalence is so similar to the increase in the spraying activity, which again is these red and blue graphs that are lines. The green line is what would have happened if it had continued on its normal path, because diabetes was increasing. But so that would have been this green line. But this is what happened in basically the 1990s. You see this starts to take this big rise up as glyphosate became part of our diet. This is autism, same kind of graph. This one is death due to obesity. Again, similar pattern to the graph. And as I said, they did this for 22 medical conditions, including a variety of cancers. They made a point about the per capita sweetener delivery. And essentially what they said is obviously sugar plays an issue in this. And they were interested in how much sugar is being delivered to us. And essentially what they saw is that sugar per capita peaked here in about the year 2000. And then it came down. And but the obesity incidence has just skyrocketed since that time. So sugar cannot be used as a full explanation of what's happened with this obesity epidemic. And there were some issues about what actually did go on just in terms of global numbers, and obesity in the last 30 years is up 70% in adults and up 85% in children. This is an interesting graph. These are so-called modern nations, and they're looking at obesity levels in modern nations. And so this one side is men and women divided, and the other side's just obesity in general. We're the bottom line here. We have the highest percentage of obesity in any developed nation in the world. We've also had marked increases in the past 30 years in diabetes, autoimmune diseases, mental health issues, and cancer in young people. And our increase in US healthcare expenditures is a staggering change. Year 2000, our healthcare expenditure was 1.4 trillion, or 10% of our GDP. 2021, it became 4.3 trillion, 19% of our GDP. And so a question that's a very pertinent question is, how did we get here? What kind of explanations are out there that would have allowed us to have a substance in our food that maybe isn't safe for us? And the discussion by the chemical corporations and the crop protection agencies, that they say that glyphosate is one of the most studied herbicides in history. Hundreds of studies have shown it to be safe. This herbicide kills plants by an effect on its metabolic pathway, and this pathway is found in plant cells and not found in animal or human cells. There are some problems with these arguments. Papers have been written that show that most of the studies they use as reference were done decades ago. Many of them were paid by Monsanto and were used to obtain the original approval for use, which is not unusual. A new chemical comes out, usually the original studies are by the company that does it. These are closely kept secrets, though, and you actually can't review any of these studies. They're held as confidential business information. Another deeply flawed safety claim, which may be the key to what may be causing a problem here, is that glyphosate is said to be safe for animals because it affects something called the shikimate pathway, which is a metabolic pathway that's found in plants and not found in animals. The problem is the shikimate pathway is not found in animal cells, but it's found in the cells of bacteria. We have about 100 trillion bacteria, this is an adult, in our microbiome, and proper ratios of these bacteria are vital for good health. We actually have more bacterial cells than we have human cells. And it's probably very significant, but Monsanto actually patented glyphosate as an antimicrobial drug in 2010. The use they patented for was malaria. But in the patent application, they listed a large number of bacterial species which are susceptible to glyphosate. And again, the bacteria that make up our microbiomes, they are vital to our health. They make chemicals that regulate mood, they produce vitamins, they help digest food, they preserve the good health of the intestinal tract, and are an essential part of our immune system. And in fact, it's not a simplification to say If you have an unhealthy microbiome, it would be extremely unusual to be healthy. And a recent study demonstrated that more than half the bacterial species in the human GI microbiome are sensitive to glyphosate. And what's interesting, when they regulate substances like glyphosate, we have no methodology of looking at the microbiome and seeing if effects on it should be a reason to regulate differently. So the microbiome is not taken into consideration. This is something they pointed out in the AAP, but a recent study, National Health Survey, looked at population in the US, and 80% of the population they looked at had glyphosate in the urine. And strikingly, what was interesting is glyphosate levels in the urine, as glyphosate levels in the urine went up, male and female sex hormones in the blood went down. This just comes from me, essentially. And basically, if you look at PubMed and ask for glyphosate and toxicity just to see that what comes up, you see 2,000 plus articles, or close to 2,000 articles published on this subject, glyphosate and toxicity. And in those, the vast, vast majority of these studies and articles and papers show toxicity. Many of them are asking the question, is there toxicity, and is the toxicity relevant? Most of them are showing toxicity and showing it to be relevant. And there are greater than 149 papers on the effect of glyphosate on the microbiome. And again, the majority of these studies show an adverse effect on microbiomes. In general, these studies show that there is direct toxicity of glyphosate formulations, glyphosate-based herbicides, to cellular structures and to plankton, bacteria, fungi, worms, insect, marine life, bees, birds, mammals, humans, and many life forms. Again, these on the cellular level, they show that despite the lack of the shikimate pathway in animal cells, glyphosate formulations are directly toxic to animal cells in other ways, basically promotion of inflammation and adverse genetic changes. So, kind of a summary of this, we don't have absolute proof that the addition of glyphosate to our food is a major causative agent in our epidemic of ill health, but organizations as well respected as the AAP think there is enough suggested evidence of potential harm that advice to our families and patients on food choices should be considered. And a pertinent question is, what are health suggestions to give our parents and our families in terms of this potential toxicity of glyphosate-based herbicides? So I'm going to start on non-GMO foods. Most of the AAP work is actually on GMO foods, but again, non-GMO foods, non-organic breads and cereals made with wheat, barley, and oats, they are frequently sprayed with glyphosate. And the problem is, for instance, for bread, I think 30 to 40% of the wheat in the US is sprayed, and we don't know when you buy some bread that's not organic, you don't know which bread you're buying. It has been sprayed to desiccated harvest and which hasn't been. So for myself and our family, we only eat organic bread at this time. And oat cereal is thought to be a health food. If you have non-organic oat cereal, chances are you're getting a portion of glyphosate with that. Non-organic legumes, including chickpeas, so hummus, we would think hummus would be a nice healthy food, but non-organic hummus has chickpeas, which are frequently sprayed. And of interest, most non-organic sugars have been treated with glyphosate-based herbicides. This is directly from the AAP paper. They're saying the same thing, choose organic when possible. And there are good studies that show when you go on a essentially organic diet, in 1 week, you can dramatically decrease your pesticide level in your urine. We all have pesticides in the urine if we eat non-organic foods. But in 1 week of an organic diet, those levels are 90% less. AAP talked about emphasizing variety, affordable, accessible, culturally relevant options. And what they were essentially saying is focus on whole foods, fruits and vegetables. If you have a non-processed whole food, you're by nature going to have a lot less genetic engineering involved in that food. The main place that we're seeing most of these genetically engineered foods is in our processed foods. And a question you might be saying, okay, what exactly is a processed food? And basically, these are foods that are made in factories, not in they don't come from farms. They use substances that are created, such as preservatives, artificial flavors, emulsifiers, and other additives designed for convenience, long shelf life, high palatability, which is a nice way of saying that they're actually quite addictive. And they often lack essential nutrients. So the feeling, and one question is, what are examples of ultra-processed foods? And they include soft drinks and flavored sodas, packaged snacks like chips and candy, instant noodles, ready-to-eat meals, sugary breakfast cereals, processed meats like hot dogs and some deli meats, and it's everything in the middle of the store, basically. Most of the stuff that comes in a box is a process or an ultra-processed food. And ultra-processed has to do with the amount of ingredients that aren't necessarily natural in it. And because there are a variety of sources that I use for this in this slides series is a bibliography that's more complete, and one can look back and see where this information came from.
And I think we can open it up for questions, Maya.
Yep, sounds great. I was just sharing that I learned a few years ago that you can use salt as an inside pesticide as well. So I was just sharing that that's what I do in my house because I'm not a huge fan of bugs. I mean, I like them outside as part of the ecosystem, but I don't love them in my house.
And traps work well. So there's that also. And it's
Yeah.
not that you can't spray at all. It's just to think the idea that I want to spray a lot is probably not a great idea. And bug bombs, particularly if there are vulnerable children around, are not particularly a good idea if you can't ventilate it well or keep them away while it's getting ventilated.
Yeah. So maybe we can oh, I don't know anything about salt guns and I don't know what they do. I just know that I call the guy and he comes over here every 4 to 6 months and sprays some stuff and then he leaves. And they told me it was salt. So I guess it's salt and water, but maybe it's salt and something else. Um, and then I think the first question, just to go back to the beginning, was about the ultra processed foods and the pesticide residues that are kind of concentrated in those foods. Do you have any knowledge on whether, I'm going to broaden the question a little bit. Renata asked whether those ultra processed foods and the high levels of pesticides meant that they are not washed or cleaned before processing. But I'm going to add to that, what, if anything, does washing our food actually do in terms of decreasing exposure to pesticides? If you wouldn't mind doing a two-part question.
So it does help to a certain degree to wash foods, particularly that have been sprayed at harvest, for instance. So washing foods is certainly a good idea.
Okay.
The issue with the Roundup Ready foods is that's in the food itself. So it's been sprayed all during its growing cycle. This would be corn that's used in processed foods mainly and soy products. So it's in the food and you can't, so in the ultra processed food, there's not much you can do about it. It's part of the food you're eating. So different than produce that you would buy somewhere. So produce certainly should be washed. But in an ultra
The
processed
ingredients of
food,
the ultra processed foods, let's say there were blueberries in it or something, would we assume that they do or don't wash them? Does it matter?
I would assume that they do wash them. But what they're talking about particularly is if you look in the ultra processed food, corn derivatives are always,
Okay.
and soy derivatives are usually in there. And canola oil is frequently the oil that's used. So kind of built into these. And it's interesting, but many of the ingredients of these are different derivatives of corn. So it isn't just corn, it's all kinds of other substances that originally came from corn, but they've been created as a factory product. And many of the products in ultra processed foods have never really been well tested. A lot of them are grandfathered in because they considered them as probably safe, and we don't really know that.
So, here in Hawaii, as many other places, but much worse here, the cost of living is astronomically high. I work with a predominantly Medicaid population, folks who are, at below, just below or just above the poverty line. The majority, there's a huge group of Alice families, which means like employed, but they don't have $400 for an emergency.
Right.
And those I think a lot of times we think of many social drivers of health, including poverty, as affecting, affecting health outcomes across the board, no matter what you measure. But what I'm wondering is, what can we do here, whether it's legislatively or, sort of on the ground advocacy type of things, in order to try to promote access to healthier whole foods for, not people like me, because, a lot of the things you're saying, I already do those things because I have those resources. But for our patients who don't have this kind of education, and who don't have, disposable income and are relying on their SNAP benefits and their WIC benefits for a lot of the food that they can purchase.
It's a great question and a sad question that we have to ask. How can we find healthy food when the majority of our food isn't very healthy? And that's really a shame. And we do more, I think we're about a third of the glyphosate use in the world. So the US and our level that we allow in our food is 3 times the level that we say is healthy for a person is 3 times what they allow in Europe. So we are much more liberally allowing this into our food than practically any other nation in the world. And that's a crime in my mind. I think it's a huge public health issue that we have to try to get people to find their way through this morass. Some of the things is Costco has been making organic foods cheaper and cheaper, which is interesting. And particularly if you can buy it in bulk and share it with your neighbor or so on. I do think that the benefits that are covered by food stamps should get stricter. I don't think soda should be in there. I think there should be an effort to try to limit some of the worst of the ultra processed foods. I think another issue as we start to grow more and more food here in Hawaii, which I think is going to happen. I understand it, 2 of the larger companies that are going to come in use a lot of pesticides in their growth process. And that's a shame. I mean, I am hoping that information like this becomes a lot more dominant in our news cycle. And I really loved the idea that the AAP had jumped into this fray in the beginning of 2024. It's really important for organizations that have credibility to get involved in this and to start making a difference. So education's a big thing, starting to talk to parents. I don't have a great answer or how anybody can afford the better foods. One of the ways, though, is to eat real food, is to talk to them more and more about, fruits and vegetables, that processed foods are the main source of so much of this GMO, of the glyphosate that's gotten into our food, and that if you can get the kids to have carrots and oranges and apples and so on, not that there isn't spraying on all those things, but you can get less, particularly of glyphosate by those things, and washing them has an effect. So more real food for sure. And using places like Costco and so on, kind of voting with our dollar, essentially, that these are better foods to eat.
Thank you. And Renata, to answer your question, I would assume olives that are organic are not sprayed, and then olives that are not organic would be sprayed.
Yeah, right. Now sprayed, so organic substances can be sprayed, but they have to be sprayed with substances, pesticides and so on, that have been organically accepted. For instance, neem can be used on organic food. So they can be sprayed, but they're not sprayed with the pesticides that we consider most dangerous.
And what are the 2 companies that you're talking about coming in? I've read something about like some Dutch companies coming in to farm in Hawaii. Is that what you're talking about, or who's this?
No, I just heard this last night, and if somebody mentioned the names, I would say, okay, that's what they talked about. And it was the first that I'd heard it, and I was embracing the idea. We certainly need to grow more of our food, but it is a shame to me if these are pesticide intensive, and most non-organic farming is pretty pesticide intensive in the US. So, and I don't know the names of them.
Might be worth finding out.
Yeah, for sure.
We
I
could
have
start
great
working on
interest,
that when the legislative session is over, which is currently exhausting.
Right.
Yeah. Folks, any other questions for Dr. Evslin? We still have a couple of minutes.
Can I ask a question about the corn products? So if the corn has a husk, on it. And if they're spraying it, we're not eating like the husk part. At least I'm not. When I buy corn, that's still, inside inside the husk. And I'm wondering like it so if it's being sprayed like at each stage of growth, does that mean that it's like just leaching in and the corn is being like doused with it? Or like if it's sprayed at like different times, like the fruits that have like a peel, like oranges or whatever, like we're removing that part. So are those safer to eat?
Yeah, the answer is yes, for sure. Now, corn is interesting, and much of the sweet corn that's sold that for us to eat is not genetically engineered. It's the corn that's used in processed foods and the corn that's used in animal food. That is the genetically engineered crops. So it's the corn, and in those crops, when it's genetically engineered, it's being sprayed 2 to 3 times frequently during the growth cycle, and it gets into the plant. So it's part of the growing plant because it's been sprayed at different phases in the plant's growth process. When you buy sweet corn in a farmer's market or whatever, chances are that hasn't been sprayed with glyphosate on the corn itself. And you're absolutely correct. Fruits, real produce that has peels and so on, you're washing a lot of that off. So the genetically engineered ones are just different. They're being sprayed all during that growth process. And that again is soy, corn, canola oil, sugar beets.
A little daunting to think about that as yet another mountain to climb.
Yes. And I don't know the answer. I actually keep meaning to look this up. How much of corn that you just buy as corn on the cob is genetically engineered? I think that number is quite a bit smaller, but it's not a number I know off the top of my head. I should, but I don't. But it's when you see corn in a processed food and it's not organic, then almost undoubtedly that is a genetically engineered corn, and almost undoubtedly it has some glyphosate residual in it.
Okay, so take home point is try to avoid those sort of very high impact foods and especially the ultra processed foods.
Exactly.
Yeah. Okay. Well, thank you for a wonderful and really educational presentation. I think we all got a lot out of it, and it's certainly a topic that we haven't had an opportunity to talk about in the almost 6 years that we've been doing ECHO. Sorry, there are last minute couple more questions. One is, has genetic engineering traveled to sugarcane? And then separate question, organic versus all natural, which is better?
Okay, good question. So sugar cane is not organic, not genetically engineered, but sugar beets are. So when sugar comes from sugar beets, most of the sugar beet in America is a genetically engineered product. And apparently, sugar of all form, unless it's organic, tends to get, most of them are sprayed with glyphosate during the growth process. For some reason, it increases the sweetness of the sugar or the concentration of the sugar. So I've read in numerous places that most sugar products that are not organic are sprayed at some fashion with with glyphosate, but not necessarily, but the only ones that are genetically engineered is the sugar beet. And the second question was natural versus organic, I think.
Yeah.
Natural, it doesn't mean much, is my understanding. Organic means it's carefully not sprayed with those things that they prohibit. Natural can kind of mean anything, I believe. So I wouldn't understand natural as meaning, oh, I have a healthy food. And I do want to leave with the concept, GMO foods, almost all of them, except maybe our Hawaiian papaya, are going to have glyphosate in it. The non-GMO foods, the things to worry about are the grains and other products like wheat and oats and chickpeas and so on that were sprayed at harvest. So because something says non-GMO, it's not necessarily safe at all. Many of these grains were sprayed at harvesting. And because they're sprayed at harvest, it's in your food by the time it gets to your table.
And then we have a comment from someone, and I've definitely heard this argument before, that when we are giving people, entitlements like SNAP, that it's not the government's or anybody else's job to dictate what folks can use those resources for, and that they should have autonomy over their own decisions. What are your thoughts on that?
I haven't thought about it deeply. I don't think that it would be incorrect to say we're going to give you some food, some money for food, but unfortunately, it can't be used on the worst of foods. Um, I don't, but I don't necessarily think that's wrong. I find it hard to say here, take this money and buy something that's really unhealthy. And regular sodas, for example, are really unhealthy. So I don't have a big problem with saying that you have your choice, you're free to take the money or not take the money, but it doesn't cover this. That's certainly common in many things that you get some money for, like insurance or whatever. So
And
off the cuff, I don't have a main problem with it. I have to say I haven't done much thinking about it.
the WIC program is similar. It's very clear on what the what kind of foods the funding covers.
You could say, why can't I buy cigarettes and so on too? I mean, I do think it's not wrong to say this is only can be used for this and this. And I
I
do
think
think
it's a longer conversation than we might have time for, but if the person who wrote that comment feels comfortable speaking openly, feel free to share a little bit more about your opinion.
And
Hi,
hi.
Linda Kim. Just saying, I'm not saying people should buy alcohol or cigarettes or anything like that, but they have a pretty strict list of what you can and cannot buy. So you can't buy any household items and all that, but you can buy food. So if a mother wanted to buy a cake mix so her child could have a birthday cake, and that would not be allowed, I mean, I think government overreach has just gone a little bit too far. People should not be forced into food choices based on whether or not they have money. And to coerce them by saying, oh, we'll take it or not, that's not really a very, shall I say, compassionate or empathetic way to treat people in poverty. That's just my personal opinion.
Thank you,
I
Linda.
don't, I think that's that's certainly an important opinion. And as I said, it's not something I've thought deeply about, although soda is so unhealthy. So there still might be some, I would say, sure, cake and whatever, I wouldn't say no. A regular soda is not a great thing. The only thing I want to leave us with too on this whole subject, it's amazing how unhealthy we've become in the last 30 years, our nation. Just look around at all of us. We're not healthy anymore as a people, and we need to address this. I believe it's one of the biggest public health issues of our lives, of our times. And we have a lot of public issues right this second, but it's something we need to address, I think, clearly and directly. It's possible glyphosate isn't the villain that I'm painting it as here. This is research that's highly suggestive that it is, and I wish the research would become a lot better and more compelling, but it's time for us to take a hard look at what happened to us. Why are we 42nd in health statistics among developed nations and spending twice what anybody else is spending? Something really bad is happening to us.
Thank you. I think this is a great conversation. I want to acknowledge the time. Lindsay has a question, and I know you can't find the button to raise your hand, but for those of you that can stay, we'll let Lindsay ask her question, and then we'll make that the last one. And anyone who needs to go, do your job, we totally understand. Feel free to head out, and we will see you in 2 weeks. Lindsay, go ahead.
Yeah, I was just going to say, I just gave a talk in CHLA about lifestyle modifications and also the SNAP and have had close friends. And I think one of the things is cooking. And I found that during the pandemic is that I've had friends now who are into gardening and now farming. And this topic is such a great topic and passionate to me because we've had seasons in my own family where we are on SNAP. Or not, it's SNAP like, it was just like, we were eligible for assistance, not when as a child, and then now in Hawaii, like friends. And so I found that cooking is a big piece of it. And that's a passion, like for teaching, because I feel like right away you do need to feed people, but then eventually education for educating folks and motivating folks, which involves some hands-on on cooking, on how to prepare these foods. Because in my slide presentation, I'm like, we got all these ugly vegetables, and ugly vegetables are good food, but you needed to learn how to cook it, which actually not everyone, depending on what family structure you grew up on, whether you were exposed to cooking skills or not. So that was just a piece of it, but great presentation. Thank you, everyone, for the talk. And I lived in Maui, and so we were for a season, and so it was with Lauren Pang, and he's lovely. He's like, he was really on the forefront of anti-GMOs. I got to listen to a lot of his thought processes like 10 to 15 years ago, and appreciate this discussion because it's been a long time. I agree when Maya said it's been 5 years that they said they haven't had topics, and I'm like, you're right, I haven't heard as much during the pandemic about what was going on. So appreciate the updates, Lee. Thank you.
Yeah, no, I think the cooking is a big issue and something I didn't cover, but that's a piece of how we move into healthier food, is to return to that skill to a certain degree.
Absolutely. Well, thank you. We had a really great and animated discussion at the end. Lots of excellent questions. So nice to see so much engagement. And obviously that's just a sign of what a great talk it was and what an important topic it is. So thank you. And we look forward to hopefully inviting you back in a year or two. Maybe we'll have some updates by then.
All right, thank you. Thank you for thank you for the invitation.
All right, everyone, you have a wonderful day. We'll see you in 2 weeks. Bye.
Bye, everyone.